Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Okay, Vincent, so tell me what's going on with your elbow, what happened?
Lately it's been hurting ever since I was 12. It's been hurting right here every time I throw a baseball.
How many years is that?
What, 12, like 2 years.
2 years or 3 years? 2 years?
2 years. Yes.
So how did you hurt yourself?
Just keep throwing.
So you're throwing, do you do that very frequently?
Yes.
Okay, how often?
5 days a week.
5 days a week. Alright, so how much pain do you feel there when you throw at worst from 0 to 10?
Probably close to 10.
Close to 10. And for the last 2 or 3 years, what kind of treatment you had for your elbow?
I didn't have any treatment.
You did not have any treatment? Okay. Can you show me the motion that aggravated? Like, let's stand and bend your elbow and tell me how much pain with that.
It's right here, I feel like a 2.
Where?
Right here.
Okay. What about, let's do this.
It's like 5.
Where? In the back.
Right back.
Or the,
Right here.
okay. 5, let's do this. That's,
I don't have anything.
so pronation, okay. An extension, what about bending? So your range of motion is actually not bad, okay. So if we want to aggravate your symptoms now, what can we do to aggravate it? Doing some throwing or something like that?
Yeah, throwing.
Okay, all right. So I will have you stand up in the hallway. Okay. So let's do 20 throwing and let me know when the pain increase. Okay.
Just like.
Yep.
Just 20.
Okay. How much pain now?
It doesn't really feel the same without a baseball.
Okay. Without the ball?
Yeah.
Okay. Well, just don't throw it, but. See the cameraman, get to the side. Camera woman. Next time probably we'll have you, we'll do it outside with the ball. How are you feeling? 0 to 10. Okay, so there's just the motion of turning, that's what aggravated.
Yeah.
Okay, we'll have a seat here. It's more in here or in here?
It's more right here.
More right there. Is that painful? Painful here?
Right there.
That's painful. Yeah, it's a big knot here, big scar tissue. Look at my thumb. See how it's rolling? That's rolling on the big knot here. And his biceps here, right in here. So when you have a scar tissue here, the biceps attach from here to here. So that scar tissue, it's like a knot in the rubber band. So the biceps, instead of normally stretch like this, to give him full range of motion, that knot will make it stretch. Does not stretch much.
Okay.
You know. So and I feel it like, and if you want to feel it, I will let you feel it with the
Yeah.
tools. It will be easier with the tools. When I get to the tools, the other tool, but I'm gonna go deep here. You feel this bump here?
Yeah.
Yeah, that's the scar tissue. And that's exactly pulling on the area he has issue with. That's where the biceps attach. So,
And that scar tissue never goes away?
perfect scenario, the scar tissue could take days, weeks, months, or years in perfect scenario
Okay.
to break. But when you have like someone practice on a daily basis, you're not really giving
Right.
time to things to break down. You know what I mean?
Yeah.
So with those conditions, especially professional athletes, I treat a lot of them. We have to really attack it quickly. So you go into the game the next day or in a few days. So you have to we have to just break it manually.
Mhm.
You know, because normally it should do. If it's bigger scar tissue, it's gonna take a week or two. You know, but that's if you're not doing anything.
Right.
But if you go into the game next day, we have to break it. Otherwise, you just have all the scar tissue, and the game you're gonna build a new scar tissue. So it's just a vicious cycle. How does that feel? Make sure it's not painful. Is it painful?
No.
So, did you see any doctor for this?
We went to council for it, and they just said that that I had an inflamed vein.
Inflamed what?
Vein.
Vein. Okay. But they did not do anything?
No.
Okay. Sorry. Is that too much? And he feel it with when he stretched that muscle, and he felt it with the extension and more with pronation. So when he really tried to get that muscle to stretch full range of motion, that's when he started to feel it. How does that feel? Mm-hmm. Do you have any game today or tomorrow?
I have a game tomorrow.
Tomorrow, okay. You feel this one?
Yeah.
Mm-hmm. Yeah. How does that feel?
Good.
Mm-hmm. You see how the tool is going deep? You cannot even see the rubber. Look at this. So I'm going really closer to the bone to really do deep release. Can you see it? It's going all the way in. This is how far it's going. So I'm actually almost to the middle of the plastic. We're not gonna leave it in, we're gonna take it out, okay? Yeah, it was all the way up to here. That's how deep the tool can go. My finger cannot go that deep. Is it too much? So it's worse in here or here? Or
It's
both?
worse from here.
Oh, sorry. Right in here, yeah?
Yeah.
Is that painful what I'm doing here?
No.
What about when I do this?
A little.
So it's actually less pressure than here. But one of the way to know if patient has localized inflammation, that area that's inflamed will not tolerate the same pressure that you do it anywhere else.
Oh, it will not
It will
tolerate?
not, because that's indicated like there's a localized inflammation in that spot. Did you see how deep I went? I
Yeah.
went to like here.
Right.
Here I'm actually not even going deep. And not applying the same pressure. Is that painful? Here. Here you go. And that's actually not even 20% of the pressure I applied here. So I gotta do other thing. And I have a special magnet. It's called Magna Heal that I use for inflammation. Okay. I'm gonna do science experiment, okay? Okay. I want to show you how strong is the magnet, okay? So hold my hand here, both of them. Hold. Okay, push my hand. You see the force? You see that? You don't have to get it strong, yeah? So that's actually the force. It's we just measure it. It's probably like 4 to 5 inches. So we're gonna penetrate the entire area here to decrease the inflammation, because here we're not tolerating this area. How does that feel? Okay, I want you to roll it out like this. No, the other way. Okay, just relax this way. How does it feel? And if you can get, like, see it, I try to get to the skin, but that magnet is actually pushing it out. That's how strong this magnet. How's that?
Good.
Mm-hmm.
What is this doing?
So when they measure it, the voltage in the cells, normal cell voltage run between 25 to 20 millivoltage. And when they measured the injured area or the diseased cells, they found the voltage went down to 5 to 10 millivoltage. Let me hold this too much. How does it feel now? You don't feel it? Okay, I'm going deeper now. So when your cell voltage runs low, it's similar to your phone. If you run on 5% of your battery, you're barely making phone calls, you're not using apps. The same thing in the cell. When your voltage is low, your body is stuck in inflammation stage, not going to proliferation or maturation. So the goal of the magnet, make sure you tell me if that's painful, okay? Is actually increase. It's like it charges the cells, so we can transition it. So because cells use electromagnetic conductivity to communicate, so we try to increase the voltage in the cells, so the cell will transition from inflammation to proliferation to maturation. And if the viewer is not familiar with the normal healing cycle, there is a link below to go over the detail about the normal healing cycle. How's that?
That hurts.
Sorry. What about here? So we still have some inflammation, and actually I have thermometer here, infrared thermometer, that we can measure how bad is the inflammation. So let me actually work on the scar tissue, and then we'll focus a little bit on inflammation after that. So for the scar tissue, you're gonna feel like you feel that grinding here.
Yeah.
Okay. Compared to nice and smooth here. You want to feel it? Feel this, how nice and smooth? Feel that? Compared to this. You feel
Oh,
that
yeah,
grinding?
yeah.
That's a scar tissue.
Yeah.
That's a scar tissue.
Okay.
So he has the scar tissue in here. The other thing we can see, like visually you can see more redness where he has more scar tissue. Make sure it's not painful, okay? How does feel?
Good.
So it's okay here, but it's all in his biceps here. Look at that. Look at the redness, and you can see that's where the area of the scar tissue. And I'm gonna go deeper to this area. Actually, no, let's try to go this way. I made a mess. Okay. Is that painful? It's okay.
It hurts.
Sorry. So he has inflammation in that spot. So I'm gonna take it easy on that spot. I'm gonna work on inflammation, but I'm gonna release everything. Make sure you tell me if it's painful, okay? And visually you can see where he has inflammation, there's more redness and actually has more scar tissue. So he's actually going back and forth. When we look at the normal healing cycle, when someone in constant inflammation, I don't know if you can see it, it's upside down. So you can see going back and forth between
Yeah.
inflammation and proliferation.
Got it.
So that's especially when you like don't take a break between games or not doing anything to interfere with the cycle to decrease the body inflammation or breaking down the scar tissue. You're just feeding the cycle with the game too.
Okay.
That hurts.
Sorry. So he has inflammation there. So I'm gonna focus on inflammation because it's the same pressure I applied here. And if you feel the pressure I'm applying is actually really not much. And I will show you where is the scar tissue. Okay, look at.
Oh, yeah.
Can you see all this redness?
Yes.
That's where he has a lot of scar tissue. So he's
Is that some of it too, this right here?
yeah, and here
So
that's a
that's
scar
there.
tissue.
Okay.
Yeah, look at this area we worked on it. Nothing.
Yeah.
I did not feel scar tissue there. So let me actually assess your inflammation. So actually, what we'll do more. So it's right in here, yeah.
Yes.
And that's what I see. I see it red all over this area, and I will show you the picture before and after. How does this feel?
Good.
Okay. It's actually the whole biceps area. Let me do it this way, actually. I see, like, I'll show you all the scar tissue here. It's causing inflammation, so he's going back between inflammation and proliferation. So that's 90 degrees, so we're gonna work on it and take another image and see. If it's mild inflammation, we should get like 3-4 degrees down after working with the Magna Heal. If it's severe inflammation, we need to spend more time on it. Sometimes I have patients, they can buy it and just wear it on it, for several hours. It depends on how severe is the inflammation. That will determine how long we're gonna use the Magna Heal. How does it feel?
Good.
Mm-hmm. So, and I coat it with the anti-inflammatory coating here, so to help with decreasing the inflammation faster. So what happened here?
My dog.
Mhm.
My dog.
Is that a bite or a scratch? Oh my god, and that's your dog. Wow. What happened? It was accident?
Yeah, it was an accident.
Yeah. Man, that's, did you have any stitches or anything?
No.
Okay. Okay, let's drink some more water. I want you to do this movement, the extension and the rotation, and tell me how that feel. Do you still feel pain or it's gone?
I feel a little bit this.
How much from 0 to 10?
2.
2, where you feel it? Same spot?
This one.
So it went down to 2? Okay. Okay, try it again. How's that? You don't feel it? Okay. Let's do the throwing and tell me how much you feel now. Okay. How's it feel?
Good.
Mhm. In pain? In pain?
No.
Okay, you can turn around and let me know what you think about the ASTR treatment.
I recommend it. It's pretty good.
Mm-hmm.
Very good.
Thank you. You need to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support the ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!